Welcome to today's video on postpartum care. The first weeks and months after having a baby are often called the fourth trimester, a critical time of healing and adjustment that deserves just as much attention as pregnancy itself. I'm Dr. Anfas, and today we'll discuss everything you need to know about caring for yourself after childbirth. Whether you've just had your baby or you're preparing for delivery, this guide will help you understand what to expect and how to prioritize your well-being during this transformative time. Let's start with physical recovery. Your body has just accomplished something incredible, and healing takes time. Vaginal birth recovery. Expect bleeding, also known as lochia, for 4 to 6 weeks, starting heavy and gradually lightening. Perineal pain and possible stitches if you had tearing or an episiotomy. Use peri bottles, sitz baths, witch hazel pads, and pain relievers as recommended. Pelvic floor exercises can begin gently when your provider gives the go-ahead. Your incision needs time to heal, about 6 weeks for initial healing. Take prescribed pain medication as needed. Use a pillow when coughing or laughing to support your abdomen. Avoid lifting anything heavier than your baby. Watch for signs of infection like increased pain, redness, or discharge. Regardless of how you delivered, all new mothers experience after pains or uterine contractions as your uterus returns to its pre-pregnancy size. Breast changes, including engorgement when milk comes in. Hormonal shifts that affect everything from hair loss to mood, fatigue from healing and sleep disruption. Remember, the bounce-back culture we see on social media isn't realistic. Most women need at least 6 to 8 weeks for initial recovery and a full year to feel completely healed. The emotional journey of postpartum is just as important as physical healing. Up to 80% of new mothers experience baby blues, mood swings, crying spells, and anxiety in the first 2 weeks. This is normal and typically resolves on its own. However, 1 in 5 women develop postpartum depression or anxiety, which requires support and sometimes treatment. Signs include persistent sadness or emptiness, overwhelming fatigue beyond normal new parent tiredness, severe anxiety or panic attacks, difficulty bonding with your baby, thoughts of harming yourself or your baby, and withdrawal from family and friends. If you experience these symptoms, especially if they last beyond 2 weeks or feel intense, please reach out to your healthcare provider immediately. Treatment works and you deserve support. Now let's talk practical self-care strategies. Rest and sleep. Sleep when your baby sleeps. Household chores can wait. Set up a bedside bassinet to minimize nighttime disruption. Accept help with night feedings when possible, especially if you're bottle feeding. Consider shifts with your partner. Maybe you sleep from 8 p.m. to 1 a.m. while they're on baby duty, then switch. Nutrition. Focus on nutrient-dense foods that support healing. Stay hydrated. Keep a water bottle within reach at all times. Stock up on easy, healthy snacks you can eat with one hand. Consider meal prep or accepting meal deliveries from friends and family. Movement. Begin with gentle walking when you feel ready. Progress gradually. Don't rush back to intense exercise. Consider postpartum specific exercise programs when cleared by your provider. Remember that rest is also productive during this time. If you're breastfeeding, know that while natural, it often doesn't come naturally. Common challenges include latching difficulties, nipple pain or damage, engorgement, supply concerns, and plugged ducts or mastitis. Resources that can help include lactation consultants, both in hospital and outpatient, local breastfeeding support groups, and online resources from organizations like La Leche League. Breastfeeding-friendly pediatricians can also be a great support. Remember, fed is best. Whether you exclusively breastfeed, pump, formula feed, or combine approaches, your baby will thrive with your love and care. Your relationships will change after having a baby, and that's normal. With your partner, communication becomes even more important. Intimacy might look different for a while, and parenting styles may differ, requiring compromise. Finding time to connect beyond baby care is crucial. Your provider will likely advise waiting 6 weeks before resuming sexual activity, but emotional intimacy can be maintained through other means of connection. With friends and family, some relationships may deepen, while others might need time. Setting boundaries becomes essential, and accepting help requires vulnerability. New parent friendships can be invaluable. Here are some practical tips to make your fourth trimester easier. Set up stations around your home with essentials like changing supplies, feeding supplies, snacks and water for you, burp cloths, and baby clothes. Have a postpartum care basket in each bathroom with a peri bottle, high-quality pads, witch hazel pads, soothing spray, and clean underwear. Lower your expectations for household cleanliness, social obligations, productivity beyond basic needs, and how quickly you'll feel normal again. While most postpartum symptoms are normal, some require immediate medical attention. Call your provider if you experience a fever over 100.4 degrees Fahrenheit or 38 degrees Celsius, heavy bleeding that soaks through a pad in an hour, blood clots larger than a quarter, severe pain not relieved by prescribed medication, redness, swelling, or discharge from a C-section incision, pain, redness, or swelling in your legs, severe headache, vision changes, or upper abdominal pain, or thoughts of harming yourself or your baby. Don't hesitate to reach out. Providers expect these calls, and early intervention is important. Remember, you're not meant to do this alone. Support resources include postpartum doulas who can provide practical and emotional support, online and in-person new parent groups, therapy specifically for postpartum adjustment, childcare help, even for brief periods, and postpartum specific healthcare providers. The postpartum period is a profound transition deserving of care, patience, and support. Our society often focuses on pregnancy and birth while overlooking the critical recovery period afterward. By honoring your needs during this fourth trimester, you're not only supporting your own healing but also building a foundation for your journey as a mother. Remember, self-care isn't selfish. It's essential. By filling your own cup, you'll have more to give to your precious new baby. If you found this video helpful, please like and subscribe for more parenting content. In the comments, we'd love to hear your postpartum experience or any questions you might have. Thank you for watching, and remember, you're doing an amazing job, Mama.